emergency signs of pregnancy that will make you to go to the hospital ASAP. These signs, if you see them, please go to the hospital. Number one is excessive vomiting. When somebody is vomiting, the person is pregnant. Eats anything he eats, anything she eats will vomit. Will vomit 1 time, 2 times, 3 times, 4 times. That is an emergency sign, and that person is supposed to go to the hospital ASAP. Because most of these people that come up with this vomiting condition, most of them, when they give birth to their baby, the baby comes down with spinal bifida. So please and please, if you know you're having this symptom, please go to the hospital so that the doctor will check up on you. Then number 2 is when the person had an accident. If you know that you had an accident doesn't necessarily mean you have accidents of the road. Accident by falling, or maybe your tummy hit somewhere. Please go to the hospital so that they will check on you and your baby. Go to the hospital because you might not know what is happening. Then number 3 is headache. When you're having severe headache, you're taking medications, it's not even subsiding, it will subside, it will come back. Mostly this frontal headache, this front headache. When you're having it excessively, please go to the hospital so that the doctor will check up on you. Because an headache might be a sign that the person is having preeclampsia or having high BP. You might not know. So that's number 3. Then number 4 sign is when the person is having a health condition, serious health condition like sickle cell anemia. You know, these people that have sickle cell and anemia, they have this crisis at times. So if you know that you have this kind of thing, or maybe you are asthmatic as a pregnant woman, please go to the hospital. Go to the hospital. Mostly those people that have this sickle cell anemia, go to the hospital so that the doctor will check up on you and your baby. Then number 5 is when the baby is moving too much. Maybe the baby used to move 10 times a day, and now you notice that it's moving 30 times, 20 times, 40 times a day. This is a sign the baby is not comfortable in that place. It might be fetal distress. So please and please, please and please, please and please go to the hospital ASAP so that the doctor will check up on you. Then number 6 is when the person is having a swollen leg, swollen face. Swollen leg, swollen face, that alone will tell you that there's something wrong. Maybe for the leg, you're trying to put your leg on the high place, it's not even coming down. It might be that that person is going to have eclampsia, preeclampsia. Yes. So please and please go to the doctor, go and see the doctor so that they can do some necessary tests for you, like urinalysis that will check your blood, check your BP. So go and see the doctor. Go and see the doctor quickly. Don't even wait. For those people that are having fetal, the baby is moving too fast than before. Sometimes the baby will not even be moving very well. You will see that baby that used to move 15 times a day will be moving like 9 times, 8 times. Sometimes you will not hear or feel the movement of the baby. Please go and see your doctor. Go and see your doctor so that intervention will be done on time to save the life of your baby and yourself. Go and see the doctor. How many of them have I mentioned? I've not been able to mention up to 10. So go and see the doctor. Then if you're having abdominal pain, you know you're pregnant. Yes, normally pregnancy you used to have pain sometimes, but this one is severe. That means that person is trying to have abortion. I mean, the person is trying to have miscarriage. So please go and see the doctor. Then when you see that you're not even in labor, and now you're now having this little water, sip of water coming out of you, that's the amniotic fluid. And you know the amniotic fluid is what keeps the baby going in the womb, and a baby cannot survive without an amniotic fluid. So go and see the doctor, because when that environment is tampered with, the baby will not be able to survive. So please and please go and see the doctors. the doctor. Go and see your midwife, go and see the doctor. I've not been able to mention up to 10, but these are the signs, the emergency signs that will make a woman, a pregnant woman, to go and see the doctor. Then okay, now I remember another one is fever. Yes, fever. It might be due to malaria, due to one problem or the other. Go and see the doctor. Go and see the doctor quickly, because this fever, it might be due to malaria, and it will even make the person to end up in theater. So please go and see the doctor when you see these signs. Please and please go and see the doctor ASAP. I remain your lovely midwife, Asuwe Bimobere Echo. Thank you.